Today, I'm going to share with you the success story of one of Park University's finest alumni, class of 2024. Um, he's Arsenial Runion. Arsenial Runion is currently serving as the Chief Executive Officer of East Liberty Health Center. Arsenial, you are welcome today.
Thank you so much, Robert, for having me.
Thank you so much. And I also have on the line Dr. Alla Adams. She is currently serving as the program director for the Master of Healthcare Administration. And she is also an associate professor of Master of Healthcare Administration at Park University. Dr. Alla Adams, you're also welcome.
My pleasure. Thank you, Robert.
All right, thank you so much. All right, so Asina, I know you are currently serving as a chief executive officer of one of the major health centers in Pennsylvania. And I know that you graduated from Park University in 2024. So within 60 months, you jump-started your career as a CEO. How did you really see yourself in that position when you were at Park University? Or is it something that came along the way?
Robert, that is a great question that you've asked me. I've always had desires and dreams to be a CEO. However, I didn't think that it would happen so quick in my early days, but I believe this program really set me up for success to be able to successfully walk into this role.
Wow. Wow. Thank you so much. I know many people, especially your colleagues, when someone comes to the MHA program, it is their desire to pursue healthcare leadership roles, right? But not all of them succeed. So, what do you think made a difference for you?
Well, I think hard work and dedication and identifying early on the need for education in an ever changing climate in healthcare was necessary. And so that was a step that I had to take part of after I completed my undergrad in healthcare administration and realized that the MHA was the next step in order to be a healthcare leader, to be able to make decisions to impact the communities that we serve.
I'm curious. Were you prepared to assume that position? I want to ask that the training that you had from the Master of Healthcare Administration at Park University after your graduation, did you feel prepared for such an important role?
You know, Robert, that is an interesting question. I think once the official offer became a reality to become a chief executive officer, um, I don't think you're ever fully prepared. I think there's a level of uncertainty and the unknown. You know, sometimes the fear of the unknown. However, I will say that Park University's Master of Healthcare Administration gave me the tools to at least to be confident enough to be able to accept the position and realize that I've been given all of the tools in my toolbox to at least be able to navigate through some of the challenges that I will eventually face.
This is just a follow-up question. So, were you already serving in a different position in that same organization before, you assumed into the role of a CEO? Did you have opportunity working with a different company, or like you would just, straight away have the opportunity to serve as a CEO?
So, yes, a little bit about my background. Before I became the CEO of this federally qualified health center in Pittsburgh, Pennsylvania, I was in Kansas City, Missouri, where I was raised the majority of my life. I was at another federally qualified health center, very large one, Swope Health, um,
Okay.
which is in Kansas City and serving over 60,000 patients. In that position, I was the director of patient experience and some operations. And working in an FQHC environment that's different from different various healthcare systems, I was able to essentially have experience in every area from a clinical, from operational, and just either fund development, grants management, those types of skill sets. And so when this opportunity came for Pittsburgh, Pennsylvania, I was, reached out to about the opportunity and further investigated it. It was within the wheelhouse, within my experience to be able to handle this. Now, did I think that at the moment that I would go from director to CEO? in such a short span of time? The answer to that question is absolutely not. But when you looked at the work that was involved, the qualifications, and let me highlight again, the MHA program at Park University allowed me to have the opportunity to walk in the room and to present myself as a valid candidate in addition to the experience.
That's excellent. Now, Dr. Adams, let me come to you. So, what do you think are the experiences or the qualities that makes a student of the MHA program stand out? And how do you see those traits translating into leadership roles like that of Arsenial?
Thank you, Robert. I think students who stand out are those who really combine strong work ethic with collaborative mindset and leading by example. If you ask me, is that enough just to be talented and just be naturally a leader to be successful? I would say that's a great question, but my short answer would be no. I think that it's not only about just being talented, it's also hard work, being disciplined, dedication to your continuous professional growth, learning, continuous learning. And I think the biggest one is the ability to work with and through others. Healthcare is a team sport, and in healthcare administration, in any administrative role, you have professionals from different backgrounds, doctors, nurses, somebody from revenue cycle, marketing people, um, information systems, researchers, pharmacy people. You have to be able to organize these professionals to work on some joint goals, to deliver on some projects. So I think that the soft management skills, that's a key.
I think I've had a couple of interactions with current students of the MHA program, and I've gone to their classes to look at how a typical classroom lecture looks like, and it was quite interesting to see them grouped into like 5 people, 3 people, and then they engage in a lot of projects together, and I learned that it is not only in one course, but throughout the course from your first year to your second year. And I know how influential you are when it comes to course design. What really influenced that decision to give them such an important skill, especially in today's business world?
That is a good question. When the program was designed, it was designed with input from practitioners, from industry leaders who emphasized the importance of the soft management skills. Out of 5 domains under the Healthcare Leadership Alliance competency model, 2 dedicated to soft skills. They are extremely important. That's why, as faculty, we decided to incorporate team projects in every course, in every class, not only in 1 or 2. I think that really kind of distinguishes Park University MHA program from other programs, the focus on the development of the soft management skills. Um, Other things in the curriculum, I would say that really distinguish us, the availability of a lot of concentrations. Right now, we offer 10 concentrations, and we just developed one more in long-term care administration. So beginning August, it will be 11 concentrations. If you look at other universities, MHA programs, there are no concentrations, or if there are concentrations, they may be 2 or 4. We have 11. And also offering sequential degree options, dual options, such as MHA MBA, MHA MPA, MHA MS in Information Systems Business Analytics.
Yeah. Arsenial, from your perspective as an alumni, and I know, assuming the position as a CEO, how do you see the MHA program of Park University as distinct from other schools' MHA programs?
Park University's MHA program to me was the most valuable education that I've had. Specifically, starting off with Dr. Adams' leadership. I mean, it has been impeccable. And for those who will eventually view this interview, I'm sure they can attest that Dr. Adams' style of teaching, she's not an easy professor, but she holds you to the highest standards. And it's not just checking off a box. You know, there's some in depth reasoning and explanations that you have to provide. And I will say only the strong survive. Along with, Dr. Avant, that was another one, and Dr. Travis Manro,
Yeah.
and and several individuals. These are individuals who are experts in their field, who understands healthcare, and want you not only to just read a book, but to understand and have this ingrained within your head. And so this MHA program, I haven't attended any other MHA programs from other universities, but I can speak to it from my perspective and tell you this the best investment that a person can make. And there will be hard days. There will be days that you will feel like giving up, but when it's all said and done, when you're in that eighth week and you've completed that class that you thought you would never be able to get through, you will understand it was worth it all.
Okay, so I think that brings me to your next question. So, looking back to your early career days, right? What kind of habits or mindset do you think made you able to navigate the challenges?
I think Dr. Adams said this earlier on, and it's a hard work ethic. I mean, we live in a society where people want things quick, fast, and in a hurry. They don't want to put in the work. I mean, it's sacrificing personal time. I mean, there'll be many times I can recall looking at the Kansas City Chiefs in the Super Bowl game, and I have my laptop out completing homework, making sure that I have my in-text citations and the formatting is correct. I mean, it is a sacrifice of your personal life, even while on vacations,
Wow.
uh, and understanding that anything worth having never comes easy.
Yeah.
And you put in the work. And I've always had a strong work ethic. I mean, it was instilled in me to always work hard, to stay focused, and even if you don't always get things right, you may fail, but you have to dust yourself off, and you have to stand up, and you have to keep persevering and pushing through in order to get what you want in life. And you can have anything that you want in life. So it keeps me consistently moving the benchmark and the goals up as time progresses.
I think in my capacity as a graduate assistant to the MHA program, I've had opportunity, having that discussion with Dr. Alla Adams, and I think it's something that with your help, we can push from alumni point of view. I think it is really going to help the students. Professional organization is perfect. You mentioned HEMS. I couldn't go for their conference this year, but I watched a series of videos about HEMS this year, and it's so amazing. It's so amazing. So I think HEMS experience, in addition to what the program is already offering, the soft management skills, I don't think there's any place that an alumni of Park University will not try. So I think it's a wonderful job that we are doing. And so thank you so much for your time today. And I'll see you again.
Thank you for
Thank
having
you
me.
so much, Robert.
Thank you.